Hi, Senator Brent Jackson. First of all, I'd like to thank you for taking time out of your busy schedule to talk with me today concerning issues with healthcare. I live in the same county as you, Sampson County, and during my time here in Sampson County, I have worked as a nurse for 24 years. During those time, I worked at our local hospital, Sampson Regional, as a medical surgical nurse, staff nurse. I was director of med-surg, staff nurse in the operating room. And I have recently transitioned into becoming a nurse educator at our local community college, Sampson Community College. Not sure if you know this or not, but the World Health Organization has made 2020 the year of the nurse because they recognize the contribution that nurses have for patient care and safety. I'd like to speak to you on the importance of increasing the number of nurses that enter the workforce. While Sampson Community College graduates around 40 new graduates, nursing graduates, annually, our local community college is having to use contract nurses from foreign countries to fill their vacancies. Recently, Vidant Medical Center had a meet and greet session for nursing instructors from Eastern North Carolina. During that time, they were building a rapport with instructors in order to gain employment opportunities for their nursing graduates once they finish with their nursing program, because they're going to need at least 300 new graduates for their Greenville location alone. This is not counting their satellite hospitals. One important way to increase the number of graduate nurses is to increase the number of nurse educators. However, when we're trying to seek qualified nursing faculty for our college, it is sometimes a problem. It's not that there are not experienced nurses who are willing to share their knowledge and experience. It is when you start discussing compensation that become deterred. Is it fair that nurse educators have to pay for furthering their education, maintain current education opportunities for their degree, while having a significant decrease in their salary? Because most nurses can work in acute care facilities and make more money than you can as a nurse educator, because there is not a market-based salary comparison. The American Association of College of Nurses recognizes that the current nursing shortage will even continue to increase even up until the year 2020. This is due in part to aging baby boomers that are needing increased hours of acute care. This is also due in part to decreased amount of nurse educators. And it is also due to increased amounts of nurses that are retiring. As nurses retire, you have less experienced nurses who are filling those positions, and new graduates that are filling those positions. The National League of Nurses and the North Carolina Nurses Association are united in their call for increased scholarships, and they want to support a market-based compensation for nursing instructors to help meet the critical need of nursing education for our future. My personal situation is not unlike many others in my field. I work full-time as a nursing instructor, and I also work part-time at our local hospital in order to supplement my income. This jeopardizes the time that I have in preparing for lectures, attending workshops and continuing education to remain current in my field, and it also decreases the amount of time that I have to prepare lab activities for my students. Again, is it unreasonable to expect nursing instructors to pay for their education while having limited compensation? The role of a nursing instructor is vital to the success of quality patient care. Nurses are the backbone of patient care And without quality education, healthcare will suffer. For these reasons, I'm asking that you support a scholarship and market-based compensation bill that will enhance the number of qualified nurses entering the acute care field. This bill will not only benefit our patients locally, but also nationwide, because we are ensuring that we will have experienced and dedicated instructors to nurture and develop the minds of our future nurses, and for those nurses that will take care of you and I when we enter the healthcare system as a patient. So what I'm asking you today is, can I count on your support?